There we go. Great. So good morning, everybody. My name is Ann Church. I'm with the Villages of Santa Fe. And this program is about fall prevention and investing in your health. And it's presented by CHRISTUS St. Vincent's, which is our local regional hospital, and AARP New Mexico. And with us today, we have Katie Titus, who is the clinical supervisor of inpatient rehab at CHRISTUS St. Vincent's. And Katie and I have the privilege of working with Katie and knowing her. And we have a great time. We did an in-person fall prevention program workshop up in Dixon a few weeks ago, before my surgery. And we had a great time and a great afternoon up there talking with people about fall prevention. So this is something we've been doing for quite some time, and we welcome you. Just a few things. You are on mute, and let me see. I believe I can allow you to, yes, you can unmute yourself if you wish and ask a question, or you can put a question in the chat. We will be stopping from time to time to have a little bit of conversation with you. This program will be recorded and will be up probably tomorrow afternoon at the villagesofsantafe.org site. So you can click on it and watch it, and also look at some of the photos from some of our other events. So this workshop is designed to reduce your fear of falling and increase your activity level. One of the issues we find is that falling is a vicious cycle. There are a lot of myths about falls. Falling statistics are things that we want you to know because I think they can give you a real incentive to be active in your health. Bad habits that increase your chance of falling. What causes falls? Not just tripping over the black dog, but what are the other causes? What is your risk level? We're going to have a little brief physical test to see what your risk level is, what to do if you do fall, and then we will also have a Q&A afterwards. Our team, we have a number of people on our team. Again, my name is Ann Church. I'm the founder and executive director of Villages of Santa Fe. I'm a master trainer with the Department of Health for evidence-based fall prevention programs. Also with us today is Katie Titus. She is the clinical supervisor of inpatient rehab at CHRISTUS St. Vincent's, which is our local hospital here in Santa Fe, where I just recently had surgery and the best outcome you could ever wish for.
All right, thanks, Anne. Again, my name is Katie Titus. I'm a physical therapist. So the most common diagnosis that we see in my inpatient rehab unit is injuries related to falls. So I have a lot of experience dealing with people who have already fallen, and that's what got me engaged in wanting to try to educate the public on what to do to reduce your risk for falling. So there are a lot of factors to consider when we're talking about your fall risk. Exercise is the number one way that you can reduce your risk for falling. It's the only evidence-based way to make yourself stronger, more flexible, better reaction time. So exercise is incredibly important. We talk about endurance, so your ability to, maintain that same level of fitness and energy over a longer distance or longer time. Strength, being able to get off of low surfaces, off of the ground. Balance, being able to sense that your body is changing in space and react to it. Flexibility, being able to take a large step if you trip. Having the flexibility in your hips, knees, and ankles to stand up from low surfaces, etc. We're going to talk a little bit about some barriers to exercise and how to overcome them, some safety tips, other related fall risk factors like medication, impairments in your vision and your hearing, and how nutrition impacts your risk for falls, and then home safety gadgets for better living and for reducing your risk for falling. Okay, so we're going to talk a little bit about the impact of falls on quality of life, which is heavy. If you have a fall, it's not just a one-time event. It can have sequelae that last months, years, depending on the impact of the fall. Older adults often fear falling, and as a result, they might limit their activities and social engagements, which again, in turn, results in an increased risk of falling again in the future. So of patients who are hospitalized for a fall-related injury, 35% of them will be readmitted for another fall-related injury, and 5% will die within a month. So we've got this vicious cycle of fear of falling, decreased activity, reduced muscle strength, balance, walking, flexibility, reducing your ability to do your day-to-day tasks, and then more likely to fall again, unfortunately. So the underlying message here is more engagement, more mobility means better health. Better health, reduce risk for falling. We know that 1 out of 4 Americans over the age of 65 falls annually, and we want to make that number much smaller. So falls are the leading cause of fatal and non-fatal injuries in older adults, and it's a big deal.
So there are a bunch of myths about falling that you may have, and we see this quite frequently, that falling happens to other people and not me. Well, I've taken a fall doing something stupid like looking at my phone while trying to step over a curb, which is really dumb. Um, Falling is something normal that happens as you get older. Again, the statistics show that there is an increase falls as you get older, but it can be prevented. If I limit my activity, I won't fall, which is directly opposite to the reality of life. As long as I stay home, I can avoid falling, which is just not true because 70% of falls happen in the home. And so many of them do happen in the bathroom as well. Muscle strength and flexibility can't be regained, and that is absolutely false. You can through a routine exercise program, really in mind, we're not talking about burpees and weights, heavy weights or anything like that, but a routine daily activity of giving you more and more activity will help with muscle strength and flexibility. Medication and vision. This is something we're going to explore later on because medication can increase your risk of falling. And also vision has quite an impact on your risk of falls. Using a walker or cane will make me more dependent. I have to say in the last number of months before my surgery and after my surgery, I have been using a walker and crutches because my biggest understanding is that while I'm recovering, the worst thing that can happen to me is a fall. And so using an adaptive device is really super important. The other one is I don't need to talk to my family members or my healthcare provider if I'm concerned about my risk of falling. I don't want to alarm them. And I want to keep my independence. Well, that's just the opposite way of it really works. You need to have that conversation. We'll talk about assertive conversation more and more. Your doctor, when you go in now, they're going to ask you if you've fallen. They're going to ask you about your fear of falling, and they should be observing your gait to see if you have an issue with falls. According to the CDC, more than 1 out of 4 Americans age 65 fall annually, and they're the leading cause of fatal and non-fatal injuries. And exercise is really the only way to prevent falls. And honestly, exercise is cheap.
But what is not cheap is the toll that falls take on our healthcare system and individual costs. So again, they're the leading cause of injury and death among older adults in the US and in New Mexico, where Ann and I live. The US spends $50 billion a year on medical costs related to falls, and we know that there are ways to prevent them. So it's important that we take action for a lot of reasons. The other consideration here, again, we talked about quality of life costs. Now we're talking about medical costs. Both quality of life and medical costs fall into this category of traumatic brain injuries as a result of falls. So fatal falls because of older adults falling, traumatic brain injuries account for 46% of those deaths, unfortunately.
So New
So,
Mexico,
sorry, go ahead, Ann.
it's okay. We live in New Mexico. You can find your statistics if you live in another state. Just Google, fall death rate from fall in my state. Here in New Mexico, we have a situation where our death rate from falls is almost 12% higher than the national average. People ask us, why is that so? We have various, the Department of Health does not have a definitive answer, but there are a lot of issues. And when we talk about traumatic brain injury later on, we are a rural state. So getting health care when you're in a rural state can mean an hour, 2 hour, maybe even a 3 hour drive to a local hospital, and your clinic may not be open. So when we talk about reducing falls and preventing falls, we are really serious about that when you're in a situation of where you've fallen and you've hit your head or something's happened, to really encourage you to get medical attention immediately.
Okay, so this is very much my purview as a physical therapist. We look closely at balance problems and how your balance is affected by three different systems. So when we say balance, balance is both the input of knowing where you are in space and the output of reacting to a loss of balance. The three systems that contribute to your knowledge of where you are in space and whether or not you're swaying or losing your balance are vision, which is what adults rely on the most; proprioception, which is sensory nerves in different joints of your body that send messages to your brain about change in joint angle. So if we talk about the foot and ankle, we've got nerves that travel all the way up to your brain to give you an inherent awareness of whether you are swaying forward or backward, whether you're climbing a hill or going downhill, whether the ground is unlevel underneath you. Vestibular function relates to a structure in your inner ear that connects to your brain to sense angular changes in velocity, acceleration, deceleration. So people with vestibular problems often have a sense of movement when they're not moving, or a sense of spinning when they're sitting still. So any change in those three sensory functions can make you slower to react to a change in your body position, or give you incorrect information about where you are in space, which can make you more likely to fall. So some questions to ask yourself related to balance. Do I feel unsteady? Do I feel as if the room is spinning around me, even if it stops quickly? Do I actually lose my balance and fall? Do I feel as though I'm falling or I might fall? Do I feel lightheaded, as if I might faint? And is my vision blurred? Am I seeing clearly? Is it clear everywhere when I look around, or are there areas where it doesn't seem the same? All of those things could impact your risk for falling. So one objective program that the CDC has developed to help assess and screen for people's risk for falling is called STEADY, Stopping Elderly Accidents, Deaths, and Injuries. So this is a series of assessments that your primary care doctor has access to. You can even ask for it at your primary care visit checkup. We do these a lot in physical therapy and in some of our in-person fall risk assessment programs. We have one every September in Santa Fe during National Falls Prevention Awareness Week. So we're going to kind of talk about what these screening assessments look like. So the first one is orthostatic hypotension. So it's also known as postural hypotension. So we're talking about a drop in your blood pressure when you change positions between vertical and horizontal. So when you're horizontal and vertical. When you're horizontal, your blood is kind of sitting equally between your head and your feet. When you go from horizontal to vertical, that blood flows down with gravity, and depending on a lot of factors, may or may not flow back upward with gravity, against gravity. So people who change positions from horizontal to vertical and have a 20-point drop in their top number of their blood pressure, that's called the systolic blood pressure, or a 10-point drop in the bottom number, which is called diastolic, may be at risk for feeling faint or actually fainting when they change positions like that. So this is a test you can have done at your primary care doctor. They do sell a lot of these home blood pressure units now. I have one, so you could do this at home. I would recommend you have someone near you, especially if you stand up and feel faint. And certainly if you feel faint, sit back down. But this is a good test to know if you're likely to get up in the middle of the night quickly and potentially faint or feel faint or unsteady.
Well, I think, Katie, this is also something that just having surgery, I
Mhm.
have to be very, very careful of, when I wake up, I need to sit up on the side of the bed and wait.
Exactly.
And that's really all you have to do, right?
Yeah, I
And
mean,
just,
and in some people in really severe cases, even if you sit and wait, this could still result in a loss of consciousness if you were to stand up quickly after sitting. But those are kind of extreme cases. So yeah, the very best thing you can do is just sit on the edge of the bed for a minute and make sure that you're not feeling dizzy before you get up.
and I guess, and you honestly feel that. You can feel that dizziness when you start to get up. So just sit back down and wait a few minutes, because the last thing you want to do is take a step and lose your balance and fall.
Mhm.
Yeah. Oh, there we go.
The next screening assessment is called the 4-stage balance test. So this test is conducted very easily anywhere. You don't need any special equipment. You're just standing in 4 different positions for 10 seconds each. If you were to do this at home, I'd recommend you do it near a countertop in case you are losing your balance so you can put your hands down. The first position for this test is feet touching side by side. See if I can angle my hands down. Second position is slide 1 foot forward, but feet are still close together. Third position is, there we go. Like you're walking on a tightrope, but just standing still, 1 foot directly in front of the other, heel to toe. And the fourth position is standing on one leg. So if you're able to get through at least that heel to toe position for 10 seconds and the other previous 2 for 10 seconds as well, you're at a lower risk for falling. So the cool thing about these assessments is usually if you're having a hard time with them, the easy way to get better at them is just to do them more often. So you can turn the 4-stage balance test into an exercise in your kitchen or your bathroom, just again, somewhere where you've got a counter nearby. The timed up and go test looks at your ability to stand up from a chair, walk 10 feet, turn around 180 degrees and go back to the chair and sit down. So like again, a lot of doctors' offices have this set up in somewhere in the treatment areas to test. So you can use your hands on the chair, you can use a cane or a walker if you normally do. We're just looking at the time. So stand up, walk 10 feet, turn around, come back and sit down. So the goal is to be under 12 seconds for this test. If it's taking you longer than 12 seconds, we assume that you're having to slow down potentially because you have strength or balance problems. So again, working on walking speed would be the goal. And the safest way to do that would be with a physical therapist. So we're gonna get some audience participation going here. So this is the 30-second chair stand test. So this is looking at both endurance and strength, your ability to stand up from a chair with your arms across your chest as many times as you can in 30 seconds. So I'm gonna ask everybody to kind of get situated if you're in a safe place to do this. I wouldn't do this on a rolling desk chair. So make sure you're on, a normal kitchen chair or couch, or if you are on a rolling desk chair, push it up against a wall or something so it's not going to slide away from you. I'm on a bar stool, so I'm not going to do this because that's totally cheating. That's super easy. But I'm going to get my timer ready. So I'll give you all another 10 seconds to get situated here. We're going to see how many times we can do this in 30 seconds.
So,
And
the example is you cross your arms and you're just going to stand up and then sit back down.
You
And
got
I'm
it.
on a rolling chair, and I've just come off surgery. So I'm like with you, I'm going to kind of skip this time. But really, folks, this is one you can do. And we will have these sheets up online tomorrow with the recording of this. So if you want to start doing this test on a regular basis, again, as Katie said, this is a great exercise. You could do it twice a day, and I bet you improve within 2 weeks. So
Absolutely.
Katie, let's go for it.
Okay, I got my timer ready. Make sure you're counting how many times you do it. And we are going in 5, 4, 3, 2, 1. Start standing. Stand up, sit down. 10 seconds down. Halfway there. 10 seconds to go. 3, 2, 1, and stop. All right, nice job. That is not easy, especially if you're on a low couch or something. That becomes tiring quickly. So in the bottom right-hand corner of this 30-second chair stand assessment on the screen, you'll see there are age and gender matched norms. So the goal is that you are above the number that correlates to your age and gender. And if you're not, again, this becomes your homework. This is a great thing to work on: full body strength, balance, your ability to shift your weight forward adequately over your feet without using your arms to help. So honestly, this alone could drastically improve your balance and your mobility if you did this a couple of times a day.
And that's so simple. We're talking about, what are you putting in a minute to this? A couple of minutes a day. And I've really seen, it really does help you understand the strength that you need in your legs, in your quads, and also just standing up and regaining your balance as you get up. I think that's great.
Absolutely.
So anyway, again, these tests will be up on our site tomorrow along with the recording.
Okay, so let's talk about what to do if you have fallen. So again, this is a question that your doctor should be asking you at your annual exam. Have you fallen in the last 12 months, and how often or how many times? Were you injured? Are you afraid that it will happen again? So these are some of the 3 basic screening questions that prompt providers to do those different study assessments. So one question I get a lot is, can you fall better? Can you fall more safely? Can you fall in a way that minimizes your risk for injury? The short answer is yes. The complicated answer is it takes a lot of practice, time, overall wellness to be prepared for a fall that you're not expecting and to be able to fall safely. The reason is we're not reacting to falls in the middle of the fall, thinking about how we're falling and trying to change the mechanics of our fall. It happens too quickly to do that. So if you are a naturally flexible, strong person, if you're mindful, if you can recognize that you're falling quickly because you're aware of your body, you're not multitasking, then you have a chance to be able to fall a little more safely. And we'll talk about what those strategies would be. So the 4 keys to being a safer faller, again, things to think about now, but really implementing regular exercise, stretching, and mindfulness are the keys to these working. If you are falling, you want to stay loose and stay bent. If you are tall and stiff, you are going to fall like a tree and you're going to hurt something that you land on. If you're closer to the ground and you are looser, you're more likely to not land on one body part, but multiple body parts. Tuck your head and look away from where you're falling. This is super counterintuitive. If you're falling, you're looking at the ground in the direction you're going. So having to think to turn your head away from where you're falling is really good to protect your head, really hard to do in real time. Landing on the meat. So we don't want to land on our boniest parts. We don't want to land on elbows, wrists, hips, knees. That's how we break bones typically. If you can distribute the weight along your thigh to your butt, as opposed to just directly on the side of your hip, think about, in like martial arts, they teach people to slap the floor because it helps distribute the force from their legs all the way up to their arms. That can help minimize the impact on one specific part of your body. And keep falling. That's another kind of martial arts strategy. Also, people who do rock climbing use this strategy. If you're falling, you want to keep falling and continue moving. Again, that helps to distribute the force in multiple parts of your body rather than landing directly on one piece. So if you really know you're going down, if you can think about implementing any of these strategies, that's great. It's just really hard to do in real time. So speaking of looking away from your fall and tucking your head, falling on your head is a big deal. We see a lot of people who do a great job coming to the emergency room after a fall. They get checked out, they're clear, they're good, and then 2 weeks later, something changes. So TBIs usually happen from impact to the head. They can also happen from sort of a whiplash phenomenon. But what you should be looking for are a few signs that we'll show on the next slide, and just know that they might show up a little later. So still very good to go straight to the ED, get yourself checked out, but you may need to come back if any of your symptoms change over time after hitting your head. So again, here are some of the mechanisms of injury. So direct impact to the brain resulting in a subdural hematoma is the most common collection of blood under the thick part that protects your brain, your skull capsule, basically where your brain sits. So that's that first picture there on the left. Acceleration, deceleration, whiplash phenomenon can also cause impact to your brain. Blast, less common, especially since we're talking about falls. But here are some of the biggest symptoms of concussion. And concussion is basically a brain injury that doesn't show up on a CT scan. So, if you go to the doctor, you get a CT, or go to the hospital, get a CT, and they say you're clear, that's great. But if you develop any of these symptoms, it doesn't mean your brain wasn't injured. It just means it wasn't injured in a way that showed up on a CT scan. So we're looking for symptoms of a headache, head pressure, loss of consciousness. That's a big one. If you lost consciousness during your fall, you probably injured your brain at least a little bit. Feeling if you're in a fog, not remembering the fall. That's just as indicative as loss of consciousness that you may have hurt your brain. Dizziness or seeing stars or spots, ringing in your ears, nausea, vomiting, slurred speech, delayed processing when people are talking to you, feeling kind of dazed, or excessive fatigue. Those are all signs that it may be time to go back to the hospital. Even if these develop 2 weeks after your fall, it's possible that it can take that long for these symptoms to develop.
And Katie, I think the important thing is to recognize the fact that if you have fallen and hit your head, you may not recognize some of
Right.
these symptoms.
Right.
That, if you know somebody who's fallen and hit their head, then what I say is right now, you're the adult here. You have to be responsible to talk to that person, and they're going to say, oh, I'm fine. I don't need to go to the hospital. Well, the reality is you cannot self-diagnose a TBI.
Mm-hmm.
And, so I say to you, be responsible and be alert to not only yourself, but other people around you who might have suffered a concussion.
Absolutely. And one of the most common symptoms of an injury to the right side of your brain is denial and poor insight and judgment.
Or
Isn't
insight,
that
I love
ironic?
it. Right. I
But
mean,
you are
it's
not the one to make that determination if you're acting
no,
normally
no.
or
And
not.
I mean, you can have that situation, they're adamant, and you just have to say, look, just humor me.
Mm-hmm.
This is not going to hurt you. It's not going to be bad, but it could save your life. And otherwise, if you don't go, I might kill you. So, yeah.
All right. So we're talking about some bad habits. So, I mentioned mindfulness as a really important part of reducing your risk for falling, and also being aware that you're falling when it's happening so that you can potentially do something about it to reduce your risk of injury. But we're going to talk about some behavior patterns that increase your risk for falls and what you should do instead. We'd like for all of you to sort of do a self-assessment. Am I doing any of these things? Could I be more mindful? Reduce my multitasking, move more safely. And we've got some simple solutions to help you reduce injury or certainly reduce falls, ideally. Okay,
So,
so let's talk about some of those, shall we?
do you want to go back at this one and talk about the risk?
Sure. Yeah, let's talk about some of them.
Hey, yeah, yeah. Oh, y'all want to unmute? And I'll just say again, after surgery, everybody ran through my house and picked up all of my throw rugs, my beautiful Navajo rugs. They're all rolled up in a corner now. I'll get them out sometime soon, but let's talk about what you think might be your personal risk of falling. Go ahead and unmute.
Well, for me, I fell like 5 times in 1 year, tripping over a curb, gardening. When I stood up, my foot slipped out from under me on it, missed a step. So my new rule is when I walk, I can walk and talk, and that is it. I do not look at my phone. When we're in an amusement park and they ask me something and they want me to look at the map, I stop where I am. I will look at it. I stop and respond to a text or whatever. I do not look at my phone while I walk. I do not do anything else. And I have not fallen since I put that rule in.
Chris, you're my hero. I love that.
I understand completely. I mean, this is not the age to start multitasking, you know?
Yeah. I'm going to throw one out there. I'm guilty of having my arms as full as they can possibly be while I'm going up and down the stairs. I'm carrying laundry, I'm carrying water glasses. I actually broke my ankle on the stairs doing this when I was in my 20s. So age is not everything. And I see in the Zoom chat, move too fast. That's right. We don't want everybody to move like a sloth, but if you slow down a little bit, you give yourself more time to react to whatever you need to react to.
And another thing I do is I always use the handrail. May
Yes,
only be one step, but I always put my hand on the handrail.
exactly. And you can't do that if both arms are very full, right?
Hey, I figure, you know, this day and age, you want to have more steps. So just put the bag down, take
Mhm.
one bag at a time, go get some more steps and increase your activity for the day just by making 2 trips.
Yeah. We got some more good points in the chat. So one leg being longer than the other, causing you to trip sometimes. So if you can do something about it, like seeing an orthotist maybe to get one shoe modified so that your legs are more equal, that's great. If for some reason you can't do something about it, then slowing down, being mindful, minimizing distractions. We've got pay attention to what I'm doing, looking down. Yep. Getting your vision checked yearly, especially depth perception. Absolutely. Yes, so often falls are related to tripping, and tripping is often related to I didn't realize how high I had to clear my foot or how far forward I had to step. Yes, absolutely.
And I think, you know, when you think about gait, you know, heel, toe, you've got to get away from shuffling. You've got to pick up your feet and go heel, toe, heel, toe.
Mhm.
And that if you starting to shuffle, that's going to really cause a situation where you're going to be at risk of falling quite heavily because you're going to be leading with your toes and not picking up your feet. So think about your gait as well. Yeah.
Those are great suggestions. Thank you so much, everybody.
All right, so we're going to go on to exercise. Exercise is important. I mean, the CDC recommends 150 minutes a week for exercise. We're not trying to talk about going to the gym and increasing weight and doing burpees. We're talking about movement. And it's very important to understand how exercise can prevent falls. We're going to talk about the barriers, why you don't do it, what exercises are best for fall prevention, and creating a daily exercise routine. Things you can do to make sure you're exercising safely. Again, don't hold your breath. Make your breath part of your exercise routine. Use safety equipment if you are biking, wearing a helmet. Drink plenty of liquids and fluids during physical activity. Dehydration can cause dizziness and leads to a fall. And we'll talk about hydration later, how important it is in our bodies. As we age, we actually don't have the sense of thirst like we had when we were younger. So you need to hydrate. If you feel thirsty, you're past that point. And we talk about warming up your muscles before you exercise. Endurance, endurance is 30 minutes of activity that makes your breath hard on most days of the week. Walking, dancing, biking, maybe just if the weather's bad, going up and down the stairs, walking in the mall. Right now we have some beautiful weather, so I'm trying to get out as much as possible 2 or 3 times a day to increase my physical therapy after surgery. But building it up to 30 minutes of activity can be very easy. We have some great exercise programs to help you with that. Strength. Exercise builds muscles. And even though as we age, we lose muscle, it can be regained by exercising. And you can join classes online like we have, and we have modifications. So if you don't feel like you can do a 45-minute or an hour class standing, you can start seated and you can keep going seated until you're ready and you've increased your strength and your endurance. flexibility. Oh my gosh, the kids are on the floor, you love them. They're watching my grandson go through his walking stage, and he was on the floor more than he was walking, down and up and down and up, and gets exhausting. But that flexibility is really important. Join a gentle yoga or a stretch class, and your body will really thank you for it. As I mentioned earlier, we have a wonderful Tai Chi class that has meditation and then just gentle movement. And that gentle movement can relax your body and increase your flexibility. Balance. Hey, balance. Simple exercises to improve your balance. We talked about that sit to stand. Just doing that sit to stand twice a day can really increase your overall muscle structure and endurance and strength. And that's going to help with your balance. Mindset. We started looking into this probably 8 years ago, and some people call it attitude, belief, demeanor, disposition, frame of mind. How does this relate to fall prevention? We're talking about assertive communication and the value of good communication with your family and your doctors. Being assertive is a core communication skill. It helps you express yourself effectively while respecting the rights and beliefs of others. I wouldn't go to a doctor's appointment without the list of questions written down, and I'm not going to leave the doctor's office till I get an answer that I understand. And I may have follow-up questions. And that is where the assertive communications come in, where you're asking the doctor to help you with improving the quality of your life and maintaining the quality of your life. Fall prevention is a team effort. And if you work it as such, if you have an exercise group that you work with, you include your doctor, you include your family, you're going to be a lot more confident and aware of how you can prevent falls and maintain your quality of life.
Okay, let's talk a little bit about medications. So 81% of older adults use at least one prescription drug. I'm 38 and I have 5. So, age isn't everything, but the older we get, sometimes the more likely we are to need to take some supplemental medications. 49% of older adults use at least one dietary supplement, so not prescribed by their doctor, maybe. 29% of older adults use at least 5 prescription medications concurrent with non-prescription or over-the-counter drugs. So when you go to the doctor and you've got your list of medications, or a bag of all of the things you're taking, don't leave out your supplements. Anne's got a good story about someone who was really, really sick and didn't know why. What was it? Kaopectate or something? It was
Pepto-Bismol.
Pepto-Bismol. Yeah.
I'm so, first of all, yes, every time you go to your doctor, make sure their list of medications are updated. People say always have a list of your medication. Now, if you have a smartphone, just line them all up and take a picture. That way you have it with you wherever you go. If there's an emergency, you have to go to the emergency department, the ED or whatever. They say, what medications are you taking? You have a picture of it. Here, this is what I'm taking. But yeah, my cousin's wife became extremely ill, and they could not figure out what was going on with her. They really actually modified their entire house for a downstairs bedroom. They just really couldn't figure out what was going on. And this is a woman who has a PhD. So I think that she has the brain cells to be able to communicate with a doctor. And it turned out she was swigging Pepto-Bismol because of acid reflux. And she had bismuth poisoning. And actually in our last deal, somebody said, well, what is that? And I was like, oh, I don't really know. But then I went and looked it up, and Pepto-Bismol has an ingredient, bismuth, and I don't know what it does to your body or to your blood cells, but it really messes them up. And but you have to do really large quantities. We're not talking about a couple of tablespoons here. So, but she did not tell her doctor that she was taking that. And even before my surgery, before surgery, think about that. They want to know about your blood thinners. They want to know about the prescription blood thinners, but a lot of supplements are blood thinners as well. So turmeric is a blood thinner. Aspirin is a blood thinner. So that's why those are things that are over the counter. And it's very important to be able to have that whole list together. I think now a lot of us use probably MyChart or something similar in your local area. And I want to make sure I not only list my prescriptions and that they're accurate. So if they change, I want to change that. But then also any of the supplements that I'm taking as well. So if I go in for surgery or if I go in for a consult, they know what I have, what I am taking.
Yeah, and how they interact with each other. I mean, supplements on their own may be just fine, but they might have a weird interaction with another prescription you're taking. So, yeah.
That's really true. And, you think I'm fine, I'm taking the same drug, but then they change the dosage.
Mhm.
And I've recently switched to the CHRISTUS St. Vincent's Pharmacy because what I love about it, our local pharmacies have gotten so overwhelmed. They really don't have time to have a consult with you. But at their hospital pharmacy, there's a pharmacist there. I have a new drug. I can say, hey, this is what I can hand you the picture of what I take. And I say, does this have any interaction? And it's wonderful to know, like my doctor during some of the prior things had prescribed gabapentin. And then I'm like, it's been used and just prescribed quite heavily for various things. And I learned that it was another drug that can cause dizziness. And so I kind of weighed whether I should take it or not. And I decided to cut it out because I didn't think the benefits were that high. So be active. This is talking about assertive communication, talking with your pharmacist and your doctor about why you're taking it. And is there any way to reduce it or eliminate it?
One thing I meant to mention on the last slide, sorry, let me add one more thing. There, when we were talking about orthostatic hypotension, that's a really common side effect for a lot of medications. So you might have never had trouble with lightheadedness or dizziness in your life, and you're on a new medication or multiple medications, and all of a sudden you're feeling faint. So that orthostatic hypotension or postural hypotension phenomenon can happen strictly because of medications. So that's another great reason to talk to your doctor if you ever experience that. Okay, moving on to vision. So annual eye exams, and I know we had some comments in the chat already about this, super important. I just got my first pair of glasses this year. I hate it in theory, and I love that I can actually see now. Your vision is the sense that you rely on the most for balance. So not only do you need to have good visual acuity with appropriate prescriptions if you need them, you need to have light when you're moving around. So get up in the middle of the night, have a way to see, whether it's a night light. Anne's going to show you some other gadgets you can use in future slides, but you have to be able to see well. So another consideration is whether you have bifocals, trifocals, or prescription lenses. Transition lenses. When you're on uneven ground, if you have bifocals, especially, your depth perception is weird. So, that's something you could bring up to your optometrist is like, I really need to be able to walk outside. And right now my depth perception isn't great with these glasses. They might be able to discuss some other options for you. Some people even have glasses they wear inside versus outside. So just keep that in mind. So in addition to vision, there's more research coming out about how hearing affects your balance. There's no direct correlation between poor hearing and falling, but your hearing is connected to the same organ that helps with that vestibular function that we talked about earlier. So it's possible that as your hearing becomes more impaired, there may also be damage to the organ that senses angular motion, acceleration, and deceleration that can make you feel as though you're moving when you're not, or give you misinterpreted signals about your position in space and your movement. The other consideration is that hearing is just one other sense to help you know what's around you. So when we talk about mindfulness, partly that is knowing your surroundings. if you're in a crowded area, especially if you're hard of hearing, you may not hear that there are people around you, or a grocery cart coming around the corner at the grocery store. So having all of your senses in tip-top shape really helps you to avoid tripping, running into things, all that good stuff.
Plus, I mean, now there's studies on hearing loss increasing your risk of dementia. So,
Correct.
it is just do it.
There's a comment from Mildred. Let me read this. You wear earplugs when you skate. So yeah, the earplugs cause an imbalance. Again, I think if you have less sensory input about, even just hearing your skates on the ground, I would imagine that would make you feel less balanced. It's possible that he might have a pressure issue with his ears too. So yeah, something to consider for sure. Okay, let's talk about footwear. So there are a lot of shoes on the market that are becoming more popular because they're easy to put on and take off. That's a great consideration. There's this new phenomenon of a low foot drop shoe or 0 foot drop shoe. And I actually went to a running shoe store in town, and I was asking the guy there about those types of shoes. It sounds like it's more for comfort and for like foot problems than it is for balance. Because we've had some questions about this in the past. And I think the idea is that, with a really rigid shoe, you're going heel toe, or you're going midfoot, forefoot, as you shift your weight forward. And with these low drop or 0 drop shoes, you're kind of rocking from heel to toe. So there's more of like a squishiness and kind of a rocker motion on the bottom of the shoe. I don't know of any research that suggests that those are better for balance. They may be more comfortable, or they may be better for specific types of foot problems. But the most important thing is that your shoe fits well. It's supportive. Typically the wider base you have on the bottom of your shoe, the more balanced you are, with the caveat that shoes with really wide bases may be more likely to hit each other when you're walking. If you have sensory problems in your feet, it's really important that your shoes are supportive and they're not overly flexible. If you're going to wear sandals, it's best to have a sandal with a strap on the heel. People trip a lot when they are wearing flip-flops. They catch the front of the flip-flop, or the flip-flop slides around or slips off of their foot. So even in your house, if you're not going to wear shoes, make sure that you've got non-slip socks on. Or carpet and bare feet, carpet and socks, not the end of the world. Yeah, no flip-flops. Agreed.
Yeah, I mean, that's one of the things we have to laugh about, because fortunately there's enough options these days. I mean, they're good sandals that have back straps, or even a well-fitting Birkenstock, where your foot slides in and it's really, really anchored to the sole of the shoe. Is really great. But I do have to laugh because I still have flip-flops, but I usually try to just keep them if I'm going to go to a pool. All right, so home safety. Again, we will have multiple things up on the site tomorrow. One of these will be this list from AARP, where you could download it and check through your house for home safety needs. Clear the clutter. We've gone in to do home assessments, and people will take the newspapers and they're piled up and they're kind of, spread out across the floor. And that's a very, very easy place to go slip and go falling with that. Clear the clutter, light it up. We'll talk about more lighting options, hold the rails, cut the skids, toss the throw rugs, and move it where you use it. So in the kitchen, if you are constantly using a piece of equipment, or don't put your coffee, if you're having coffee every day, don't put your coffee up where you have to climb up on a step to get to it. You want to use it, move it where you use it. It makes all the sense in the world. So we're going to talk now about hydration, which we feel is very important. We live in the high desert. So Katie, how much should you drink every day?
I'm drinking out of my silly pint from Ski Santa Fe right now as we speak. I've got a water bottle I keep at work all day long. going back to orthostatic hypotension, if you do not have enough water and you don't have enough volume in your blood pressure tends to be lower anyway. You change positions, it gets lower, you feel dizzy. Changes in your electrolyte balance are really affected by your hydration. So super important to drink water all day long. A lot of people tell me that they don't want to drink water because they don't want to have to go to the bathroom. A lot of people deal with, incontinence or, got to get to the bathroom super quickly if they feel like they need to use the bathroom, urgency, frequency of urination. So especially at night, people are hesitant to drink water because they don't want to have to get up in the middle of the night. So the tip there is to drink water at pretty regular intervals most of the day and then stop around 5 or 6 p.m. Falls do happen frequently in the bathroom, so I understand that concern, but your bladder is a muscle. So if your rationale is that you don't want to fill up your bladder ever, you're going to shrink that muscle and it's just going to make you feel like you have to go to the bathroom even more often if you're not drinking regularly.
Yeah, and we were talking about electrolyte. I mean, there's a whole lot of noise about electrolyte waters these days, but they're really nothing special. And most of the ones that you buy are pretty much loaded with unnecessary things. And so I love to make up my own, which is basically, water, because you're going to start with a whole lot of water, a little bit of salt that helps with the electrolytes, and then I throw in some frozen pineapple, and then I have this wonderful syrup from Portland Syrups called spicy ginger, and I put in a couple of tablespoons of that, and I make a cooler, not a cooler, a blender full of that. So that's like 36 to 40 something ounces, and it tastes delicious. And so if you're, I can't drink that much water. So drink water, drink herbal tea, make yourself an electrolyte drink, whatever you want to do, but keep sipping on a daily basis, because here's my water bottle right here. Villages of Santa Fe. So we're going to talk now about gadgets for your home and safety. One of the things that we talked about earlier was lighting. Very, very critical these days, because as we get up in the middle of the night, we move around. We don't want to be turning on the lights. We don't want to turn on the chandelier going up the stairs. So in my house, I probably have at least 8 motion detector lights, and they can be any size. I do have some small ones that are about this size. They're these round ones that you see on the left-hand side of your screen. They are battery run LED. They cost about $15 for 6 of them from Amazon. And I've got to tell you, I have them going up my stairwell. Instead of having to turn up the light, turn the big light on at the middle of the night, I can go up the stair and just lights all the way up. I have plugins in the bathroom, which are great. If I go to the bathroom, the light will come on in there. Also, if you see this middle photograph down below, there's a step, one step in my garage. Now, when you go in your garage, your overhead light comes on. It's not that bright. And with that step, I can see exactly, and it only comes on when I get close to it because it is a motion detector light. And so I can see that step, I can step up, and then there's another motion detector light right by the place that has the light switch and the garage door. So very, very safe for me to get in and out of the house. This other one is a bed light, which is really fascinating. It's a long strip with LED lights on it, and it has a motion detector sensor to it. So you can literally stick it underneath. So you come along underneath your bed frame, and it has an adhesive strip, and you can just adhere it to underneath your bed. So when you step out of your bed, this very low light comes on. You can time it as to how much time you want it to stay on. And that's a wonderful way to get out of bed. Save me from tripping over the dogs, because the dogs are always underfoot. They're right by the bed. Those are a really good one. Also, we talk about using here in town in Santa Fe, our streets are terrible as far as our sidewalks. They're just in many cases non-existent. So you'll see around town people using these trekking poles. I have a pair in my car that I use not only in town but out of town when I go hiking, and they're great to have. You can have the tips that have the rubber tips, just like a cane, but they really can help you with stability. And I really recommend, if you're walking a lot, to go ahead and use them as well. The other thing that we're constantly asked is, I live alone. I know people who have fallen, or I've fallen and I've not been able to get up. I have an Apple Watch. Honestly, I think every single one of our instructors has one as well. They are just phenomenal as far as being able to alert for falls. They're the only watch that I know of at this point that actually do it. The downside, you do have to have an iPhone. But the Apple Watch, if you fall, it has a deceleration app to it, and it knows if you've taken a fall. It'll come up with this, it looks like you've taken a hard fall, emergency call, or I'm okay. If you do not, let's say you're knocked out, let's say you fall, you hit your head and you are out. If you don't respond to this, it's going to not only call 911, but it's going to call everyone that is on your medical alert system in your iPhone. And it can be a life changer. And if something happens also and you fall, or it's an emergency and you don't have the ability to get to your phone, you can actually hold the side of your Apple phone down and it'll come back and allow you to make an emergency call. Again, there are downsides because you have to have certain technology, but I think it's really, really important. So, what to do if you fall? Stay calm and be assertive. When I've seen people fall, or if I've fallen, people rush over to help you. They're like, let me get you up. Take your time. Take a deep breath. Check for injuries. Do you have a break, a sprain? Is there blood? Be aware of what's happened to you and don't try to get up immediately. Not only can they hurt you, but they could hurt themselves as well. So just take a deep breath, analyze what's going on. Did you hit your head? Did you lose consciousness? If so, call 911. We really emphasize this situation, and in our in-person classes, we also bring in our local EMTs that talk about their role in your life and how they are usually the first line of defense of people, and they get the first call if there's a fall and somebody can't get up. So it's really important. The other thing I didn't mention, that when we were talking about brain bleeds, I'd really like to talk that just for a minute. The police chief, not the fire chief in Dixon, brought this up. If you are on blood thinners and you fall and hit your head, go get checked out. That's when they're looking at, when they answer a falls call and they talk to somebody, if they hit their head, do you take blood thinners? Because again, that can cause an even more serious brain bleed. So we want to welcome, we're glad, very happy for you to be here today. With Villages of Santa Fe, we do offer, oh my gosh, right now we're offering, I think, somewhere in the neighborhood of 15 to 18 classes a week. 12 of them are online. You can get a free pass for those classes and also our videos if you'd like one. We'd love to have you join us. And we want to thank everybody here for participating. And this is sponsored by AARP New Mexico and CHRISTUS St. Vincent's and presented by Villages of Santa Fe. So we'll just open it up, and I think we'll look at the chat and see what other questions we have. The exact products, that'll be in online. Yeah, Love and Motion Lights. Hey man, just get them. Your life will change with having just this one package of motion lights. And again, they're from Amazon. I'll put the link to that. And I've used the same ones over and over again. Somebody asked where you can get the spicy ginger syrup. Oh my gosh. Portland syrups. They are a Portland company, Portland, Oregon. That's where my daughter's a doctor. And I found them about 2 years ago. And it's a small family-run company. And they have ginger, they have Marionberry, they have Meyer lemon. And it makes your water just zing. And so, yeah, Portland syrups, you can just Google them. And I order that on a routine basis because it really keeps me drinking water. So we'd love to hear from you. I'm going to stop sharing now. So we will. There we go. Somebody asked if yes, the recording will be up tomorrow. We don't put the slide deck up there because we're changing it on a regular basis. But if you would like a presentation, you're more than welcome to get in touch with us. And we could possibly work out a schedule for you. We do have quarterly online fall prevention programs as well. Katie, do you have any wonderful words of wisdom there?
Keep moving. Never stop moving. Practice getting on and off the ground if you can do so safely, or ask someone to teach you how to do it safely.
Well, that's a really good point. We've had people say, I've had knee surgery or something and I can't get up off the ground. Well, go to your primary care, get a referral to PT, and tell the PT person, I want to learn how to get up off the floor.
Not just if you fall, it's just a good skill to have. And
No,
honestly,
just to get up off the floor. Yeah, yeah.
You need strength and flexibility, and yeah.
There are ways, even if you've got joints that are not working so well, to learn how to get up off the floor, because I think that's the worst thing, to think you're going to fall and you're not going to be able to get up off the floor or find your phone or get any help.
Yeah. There are questions in the chat about specific links to the lights you're talking about, Anne. I don't know if you have that Amazon product specifically somewhere.
Yeah, I'll put that list, I'll put that link. And also, so the steady assessments will be up there. The AARP home list will be up there, and I also have the link to Amazon for some of those items.
And that's on your primary website, right?
That'll be up tomorrow in the blog. So if you just go to the homepage and scroll down, it'll be the first blog there. And if you would like to have a welcome wellness pass, you can go to our home site as well and click on that pass. And just all we need there is your name and your email. It's absolutely free. There's no credit card, no nothing. We just want you to keep moving. Thank you, everybody. We appreciate it. And we'll be back probably in February, I guess it'll be. Look for us then.
Thanks, everyone.
Thank you.
Is
Yes.
a question. I'm not very good apparently with this. How do we get to the recording? Is there a link somewhere in the first email that we can get the recording from? Or I don't know that I understand how to get it.
You can go to our website, villagesofsantafe.org. It'll be up tomorrow afternoon.
Villagesofsantafe.org. Okay.
Yeah, I think Katie
I'll
put
write
that
that down.
in the chat. And you can go, it'll be in the blogs. Actually, if you just scroll down on the homepage, it'll be the first blog, probably tomorrow afternoon after about 4 p.m.
Okay.
Good morning. I just also had I was hesitating to ask this, but I guess I just need some guidance because I have two elderly in-laws. They're in their high 80s and 90s. They're very independent, and also can be strong-willed. And so I'm looking for guidance, like whether it's somewhere in the villageofsantafe.org or something, because one in particular, it's like, no, I don't want to exercise. I'm at this age. It's like I've done this well so far. We've done well. We don't need help. That kind of a scenario. And so I'm just looking for some guidance or recommendations as to maybe where I can go. I love them both, and at the same time, I don't know that I have the kind of relationship with them right now wherein we can have that kind of a conversation.
That's a hard one because you can't make anybody exercise.
Exactly. It's a choice. And so I'm like,
Right. But also sometimes one of the great things about our programs, our exercise programs, is all the instructors are over 70.
mm,
So just like with me, I've just had hip replacement surgery. They've had hips, they've had surgeries, they've had shoulder issues, they've got pain issues. So sometimes when people think about exercise, they think about going to the gym and heavy weights and all of this. And we're talking about movement.
mhm,
And so if you could possibly even tune into something like Judah's Chair Yoga Express on Friday morning, or KK's meditation and movement, maybe that could inspire them to do some things that they might not even really consider exercise.
okay. Thank you. I
That's a
appreciate
great
it.
question. That's such a
I-
challenge. And you know what? The family dynamic makes it way harder. It's hard to take advice from anyone you're
Yes.
related to.
This is Barbara again. I see when you get to the site, it says register or sign in order to be able to get to the recording. Do I need to register or sign in or what?
If you will, the recording is not up yet. It'll be up tomorrow.
I know, but it's like when I get to the site though, it seems like the only option right off the bat is register or sign in.
That's for classes if you'd like to take some of the classes.
But otherwise, what else is, I mean, how can I access the recording?
Okay, tomorrow, if you scroll down on the page, you will
Yeah,
see blogs, and it'll be at the very top of the blogs.
blogs. Okay, in the blogs. Okay, thank you.
Yeah, those are
Thank you.
absolutely open to the public and free.
Okay, thank you.
You're welcome.
Okay, bye.
Bye.
Okay.
All right, Katie, I think we are done for the day, and we appreciate your coming and attending, and we will hope to see you in class.
Thanks, everyone.
Thank you. Bye.
Thank you. Bye.
Thank you.